Hey, what's going on, guys? Joe Marfrales here, doctor of physical therapy. I wanted to talk to you guys today about an issue that I see a lot with home health as well as in outpatient when I used to do outpatient work, and pretty much in every single setting. And whether you're cash based or you're an employee or you're an entrepreneur or anything like that, I wanted to talk to you about a problem that I commonly see, and that is cancellations and missed visits. So, I wanted to talk to you about 3 ways that you can improve patient compliance as well as reduce the chances of having a missed visit. So, in home health, which I've worked in for several years now, missed visits are a big thing. And basically, it's when the patient cancels on you and makes up some type of excuse um, about whether they can see you or not. And this happens a lot in outpatient as well as in various other settings. So, what are 3 ways that you can improve patient compliance and reduce the risk of missed visits? Well, as a physical therapist, you have your doctorate. All right. So, you need to realize that you are an expert in your respective field, just like how a respiratory therapist is an expert in the respiration system, how a cardiologist is an expert in the cardiovascular system. A physical therapist is a musculoskeletal expert. We also have knowledge in cardiopulmonary rehab. We have knowledge in neuromuscular rehab. We have a lot of tools under our belt. All right. We didn't go to school for, 6+ years to simply be staff PT that just, makes simple decisions. A lot of times it is based on your confidence, more or less. So, number one, at your first visit with a patient, you want to establish yourself as the expert. Okay. There's various ways to do this. And one of the ways that I establish myself as an expert is I explain to the patient exactly what the process is, what to expect at evaluation, and what why they're in the position that they're in. A lot of times, most of the time, if a patient isn't a former nurse or a former doctor or something, they have no idea what's going on. They have no idea what to expect from physical therapy. They may have preconceived notions from what they received in the past about what physical therapy is. So you need to be able to explain to them in a simple way why they need what they need and what you're going to do for them. So you need to establish yourself as an expert. And so people who I've encountered who are very good at establishing themselves as experts are very good at explaining complex things in very simple ways. So using analogies, talking about, how it's applicable and what it's going to do for them in the long run, how it's going to benefit them. Even just throwing like little gems in there about, what they can do. So during evaluation, what I like to do is I like to tell patients, hey, have you ever had physical therapy before in the home? Very simple question. It's open-ended. And most of the time, they're like, no, I've never had home health physical therapy in the home before. So then I explain to them, okay, well, our job as home physical therapist is to make sure that you are returning back to your previous level of function before you went to the hospital. We need to set up a home safety plan for you, make our recommendations in terms of necessary DME, make our recommendations in terms of activity, and also just letting them know, hey, if for example, if you're seeing a total knee, just telling them, hey, this may seem like a very daunting rehab, but in all honesty, you're going to be doing fine. And in a few weeks, your knee range of motion should be improving to this amount of degrees. So just simply saying things like that, by reassuring the patient and telling them what the expectation is and what their rehab is going to be like at home, really helps to establish yourself as an expert without delving into like all these little intricacies that most people will not understand. All right, so that's number one. Number two, you need to establish boundaries right away. So at evaluation, whether it's at the end or in the middle, I'll usually tell the patient, hey, like, we have orders from the doctor to do this evaluation. And so my expectation is that, we're going to teach you things that will help you and get you back to where you were. And that all we ask is that you just participate and that you just make an effort to do the simple things that we ask. And we're always going to make sure that we're working towards your goals, and that we're going to tailor the therapy experience to your personal situation. All right. So by establishing that boundary right away, you tell the patient, like, hey, like, your doctor ordered this. We are going to be doing therapy, and that we're expecting you to participate. So it kind of tells them in a not so harsh way, like, yeah, you're going to do this, without saying that. So the third way that I improve, or that I increase patient compliance, is that I make sure that I always ask the patient, okay, what do you want out of physical therapy, and what are your goals? And most of the time, they'll tell me something general, and sometimes they may be a little bit more specific in their goals. But you want to ask that question about what their goal is, because without establishing a clear set goal, you're going to be wandering aimlessly into a plan, and the patient's going to know it. You can't just be giving general non-specific exercises or performing tasks that are not tailored to this specific patient. If you make it known that you're all about their goals and that you want them to achieve their goals and that you'll help them get there, usually they buy in right away, and they will comply more with what you're telling them, and they'll comply more with treatments. And if they know that they have a goal that they want to work towards, they will be a more active participant in therapy. So those were 3 ways that I personally use to improve patient compliance, as well as reduce the risk of a missed visit. So if you enjoyed that video, make sure you hit the subscribe and like button below, and I will talk to you guys later.